First things first, you want to get your patient's weight on the patient's weight corresponds on the X-ray chart, along with the view you're going to take to see what you need to set your machine to. For ours, our patient weighs 45. So I set my machine to 80 with MAS 5 and collimate appropriately. Once the machine is set and your protectional wear is on, you are ready to lift your patient onto the X-ray table. With your partner, lift your patient onto the X-ray table. We chose lateral being less stressful for the patient because it's the easiest and less stressful for the patient. Now that the patient's on the table, you want to collimate appropriately. When taking thoracic radiographs, getting the right your landmarks in your view are going to be so for a thoracic radiograph inlet. Our landmarks are caudal part cranial of the 13th rib, thoracic inlet, caudal 13th rib, and the middle landmark. Should either be on the scapula or slightly below, or, depending on how large your patient is. Right next to it caudally, depending on how make sure your large your patient is, but not too far in. So when you take the X-ray, your marker's in the chest. It needs to be right next to it, and then get your view. For thoracic X-rays, you want the X-ray to be on inspiration. It's better for the and there's your lateral X-ray to have the lungs filled with air and fully expanded, so you can see all of the lung space. Next, we're going to do our VD and kind of judge more accurately what's going on in there. Next, we're going to get our VD. Put your patient on its back. And disregard this one. Unfortunately, our X-ray light burned out X-ray and video mid shoot. So we know roundabout with our landmarks where the light is. And we use our X-ray same landmark picture. So the thoracic inlet, the 13th rib, and then the middle. And we didn't change any of the collimation, so it would be like the lateral view that we took. Best position to evaluate the heart is a DV. Try to feel for the 13th because you can see the heart more detailed. It's closer to the plate. Make sure they are flat on their back. And the best position to evaluate the lungs is, and again, you want to get on inspiration. So the lungs are nice and filled with air. More detailed. It's also closer to the plate and expanded fully. Now, for this one, we're going to retake it because the marker shouldn't be in the chest. It kind of looks like a foreign body there. So we're going to retake it, and we're going to move the marker out. And that's more appropriate to send off as well. If you're sending off X-rays, you don't want to send it off with the marker in the chest. So the best position for evaluation of the heart is a DV. It's more detailed. The heart's also closer to the plate. It's easier for patients to breathe. So if they're in congestive heart failure or any sort of heart issues, it's better for them. More comfier, since the heart is in the kind of more of the front of the chest. And then the best position to evaluate lung radiographs on the thoracic radiograph is a VD.